You wake up, you sit on the edge of the bed, and before your feet even touch the floor, your knees, your hands, or your back already feel tight, like your body forgot how to move overnight. For most people, this fades in a few minutes and life goes on. But for some, that stiffness sticks around. It lingers through breakfast. It's still there an hour later. And according to doctors, that single detail, how long your morning stiffness lasts, can be one of the earliest clues that something bigger is going on inside your joints. Today, we're breaking down exactly what's normal, what's not, and the specific signs that should prompt a conversation with your doctor. Stick around, because by the end of this you'll know exactly what to listen for in your own body. Let's start with what's considered normal. As we age, the cartilage in our joints naturally thins, and the fluid that keeps joints moving smoothly, synovial fluid, circulates more slowly while we sleep. So when you wake up, your joints are essentially cold, the same way a car engine takes a moment to warm up before it runs smoothly. For most older adults, this kind of stiffness lasts somewhere around 5 to 15 minutes. You get up, walk around, maybe stretch a little, and your body loosens up on its own. This pattern is so common that it's considered a normal part of aging, and on its own, it's generally not a cause for concern. But here's the detail that doctors say matters most: duration. According to clinical guidelines used by rheumatologists, if morning stiffness consistently lasts longer than 30 minutes, and especially if it stretches past an hour, that's considered a potential signal of an inflammatory process happening inside the joints, rather than simple wear and tear. This distinction is so important that it's actually one of the first questions many doctors ask when evaluating joint pain in older adults. How long does it take before you feel normal in the morning? Let's bring this to life with an example. Picture someone we'll call Margaret, a 68-year-old retired teacher. For years, Margaret's mornings followed the same pattern. A little stiffness in her knees, gone within 10 minutes of walking to the kitchen. But over a few months, something shifted. She started noticing her hands felt swollen and stiff when she woke up. Not just one hand, but both, especially around her knuckles and wrists. And instead of fading quickly, it would take her 30, sometimes 45 minutes before she could comfortably grip her coffee mug or button her shirt. Margaret chalked it up to getting older and didn't think much of it, until a routine checkup when her doctor asked a simple question: does your stiffness affect both hands equally, and how long does it usually last? That question opened the door to a conversation Margaret hadn't realized was important. The pattern she described, stiffness lasting nearly an hour, affecting both hands symmetrically, involving the smaller joints like fingers and wrists, is exactly the kind of pattern associated with rheumatoid arthritis, an autoimmune condition where the immune system mistakenly attacks the joint lining. This doesn't mean everyone with morning stiffness has rheumatoid arthritis. Far from it. But according to the Arthritis Foundation and major medical references, this specific combination, prolonged morning stiffness, symmetrical involvement, and small joint swelling, is one of the clearest early indicators doctors look for. And the earlier it's identified, the more treatment options are available to help prevent long-term joint damage. Now, let's talk about a second pattern that's specifically relevant to older adults: stiffness centered in the shoulders and hips. This brings us to a condition called polymyalgia rheumatica, or PMR. Unlike rheumatoid arthritis, PMR almost exclusively affects people over 50, and it tends to cause significant aching and stiffness in the shoulders, neck, and hip area, often described as feeling like you've run a marathon you don't remember running. Here's another example. Consider a man we'll call Walter, age 74. Walter had dealt with knee stiffness for years. Nothing unusual, fading quickly with movement. But recently, he noticed something different. Every morning, his shoulders felt so stiff and sore that lifting his arms to comb his hair or reach into a cabinet became a genuine struggle. It wasn't sharp pain, it was a deep, heavy ache, worse in the morning, worse after sitting for long periods, and it just wasn't going away. Walter assumed it was just another ache that comes with age, and didn't mention it during his checkup. It wasn't until his doctor specifically asked, "Have you noticed any new stiffness in your shoulders or hips, especially in the morning?" that Walter realized this was worth discussing. According to medical sources, PMR is significant not just because of the discomfort it causes, but because it can sometimes be connected to a related condition called giant cell arteritis, which in rare cases can affect the blood vessels supplying the eyes. This is precisely why doctors take new shoulder and hip stiffness in older adults seriously, even when it seems like just another ache. There's a third pattern worth mentioning, and it's one that often gets overlooked because it seems like the most obvious explanation: osteoarthritis that has progressed. Osteoarthritis is by far the most common joint condition in older adults, and it's usually associated with that brief, short-lived morning stiffness we talked about earlier. But in more advanced cases, stiffness can last longer, pain can intensify, and some people describe a sensation of the joint catching, or briefly locking up during movement. This doesn't necessarily mean something dangerous is happening, but it can mean that current treatment approaches may need to be revisited. There are many ways doctors can help manage advancing osteoarthritis, from physical therapy to other interventions, and recognizing that the condition has changed is the first step toward addressing it. So, what should you actually take away from all of this? Let's break it down into a few practical points. First, track the time. If you genuinely don't know how long your morning stiffness lasts, start paying attention. Is it 5 minutes, 15, 45, an hour? This single piece of information can be incredibly useful to a doctor. Second, notice the pattern. Is it one joint or several? Is it symmetrical? Both hands, both wrists, both shoulders? Symmetrical involvement is one of the key details doctors listen for when considering inflammatory conditions like rheumatoid arthritis. Third, pay attention to what comes with it. Persistent fatigue, low-grade fevers, unexplained weight loss, or visible swelling around joints are all details that, combined with stiffness, can help build a clearer picture. Fourth, don't wait until it's bad enough. One of the most common things doctors hear is some version of, "I figured it was just normal aging, so I never brought it up." But for conditions like rheumatoid arthritis or PMR, earlier evaluation generally means more treatment options and better outcomes down the road. And fifth, this video is not a diagnosis, and it's not meant to be one. Its purpose is to help you describe your symptoms more clearly and recognize when something has changed enough to be worth mentioning. A simple conversation, a physical exam, and sometimes a basic blood test can help your doctor determine whether what you're experiencing is part of normal aging or something that deserves a closer look. It's also worth repeating. Most morning stiffness is completely normal. If you wake up a little creaky and feel fine within 10 or 15 minutes, that's not a red flag. That's simply what aging joints often feel like. The goal here isn't to make you second-guess every ache you feel. It's to help you recognize the difference between "this is just how mornings go" and "this has changed, and it's lasting longer than it used to." Think about your own mornings for a moment. Has anything changed over the last several months? Is stiffness lasting longer than it used to? Has it spread to new joints? Your hands, your wrists, your shoulders, your hips? If something has changed, it doesn't mean panic is necessary, it means it's worth a conversation. And if you have a parent, a grandparent, or an older friend in your life, consider sharing this with them. So many people brush off these changes because they assume it's just part of getting older, and the conversation never happens. Sometimes all it takes is someone else pointing out, "Hey, that doesn't sound quite normal. Maybe mention it next time you're at the doctor." Before we go, thank you for taking the time to learn something that could genuinely make a difference. For yourself, or for someone you care about. Information like this becomes useful the moment you're sitting across from your doctor and can say, "My morning stiffness has been lasting almost an hour, and it's in both hands," instead of just, "I've been feeling stiffer lately." That extra detail can make all the difference. As always, this video is for educational purposes only and isn't a substitute for professional medical advice, diagnosis, or treatment. If you are noticing changes in your morning stiffness, talk to a qualified healthcare provider. If this was helpful, share it with someone who might need to hear it. And if you'd like more videos breaking down health topics in plain, practical language, let us know in the comments and consider subscribing. Take care of yourself, listen to what your body is telling you, and remember, sometimes the smallest details are the ones that matter most. Thanks for watching, and we'll see you next time.